with patients who are in the hospital every day in post-acute care. We speak with the nurses every day with a panel of patients, and we go through every patient with their past medical history, what their current clinical condition is, and so forth. And in that, I had a peer-to-peer with a provider on a patient that they were trying to send to a subacute rehab. But as I reviewed the notes, I see that the member's hypotensive and they have hyponatremia, and we're looking and we're saying, well, I said, this patient needs to stay in the acute setting. You know, these are the numbers that we've seen recently and so forth. And the provider's like, really? Is that what's been seen? And so he reviews the notes and says, you're right. You're right. This member is not ready to go to subacute or inpatient or anything as such. And ultimately, I spoke again to that same provider, and ultimately this patient improved and in fact didn't even need to go to a subacute or inpatient. The member was able to go home.
Went home.
Once they were stabilized appropriately.
Sure.
So again, a testament to the idea of doing the right thing for the patients. So.
Yeah, and the post-acute care program is a pretty intense program. You know, from our standpoint, I mean, it's and I think it takes that level of involvement, right? But yet outside of in the real world, in the health plan world, there's not nearly that degree of involvement, which I think is why so many patients fall through the cracks.
Right, it's huge to have another set of eyes on the case. It makes a difference.
That makes the program pretty unique.
Exactly.